and that we'll be able to hold another one in the future. So I'm hoping it's going to be a great few days, but it's really wonderful to have you all here. I know it's involved lots of organizing, lots of planes, lots of logistics, lots of people missing flights and getting on new flights. So thank you everyone who really made such an effort to get here. Just to go a little bit through the program so that we're all clear on what it's about and how it's going to work. I'm going to just introduce the broad objectives of the summit now, and then towards the end of the session I'll come back again and I'll just explain a little about how everything's going to work. Okay? But we just want to alert you there are two changes in the program for today. Just to give apologies from Carlo Oliveira. He is the coordinator for the Adolescent Treatment Coalition. He sadly lost a family member in the Orlando massacre, and he was not able to be with us here today. So thankfully, I think I've seen Cedric somewhere, but Cedric from AY Plus has kindly agreed to take Carlo's place this morning, and he's going to give us a presentation on a survey that was conducted by Y+. So just to alert you to that, and also Dr. Patrick Oyara, who was meant to be chairing the afternoon. People are hopefully clear on why we're here. But the summit really serves as a platform to drive action for young peer supporters. And I think importantly, this summit's focus is on peer supporters. And whilst we have a few, not many, but a few peer supporter supervisors here in the summit, I think we want to make it very, very clear that the summit is for young people, it's about young people, and it's mostly led by young people. I'm just an excuse of a young person here this morning, so hopefully you're not going to be seeing too much of me. But it's to really initiate, collaborate, and advocate. And that's what we're going to focus the next 3 days on. Day one, which is today, is going to be more of a personal experience. It's going to look at our lived experiences of being peer supporters and your efforts in making sure that you secure well-being and health. And we want to look at creating opportunities in terms of your careers and life within being a peer supporter and definitely beyond being a peer supporter. Tomorrow we're going to focus a little bit more on this word we love using called adolescent-friendly health services. Yeah? So we all talk about adolescent-friendly health services, but we need to start thinking about how we actually walk the talk of adolescent-friendly health services. So what do we mean by adolescent-friendly health services? And more particularly, to give thought to those who are not accessing service, so those who are the most marginalized from our services. And day 3 is really dedicated to linking up and speaking up and making sure that we get our peer supporters well connected to the country network representatives that have also joined us at the summit this year. So that's the 3 days. We're going to be keeping you very busy. Really importantly, please to try be on time so that we've got a lot to cover in the 3 days. Just a little brief summary on why you may have noticed Pata looks a little different at this summit. You're normally used to other Pata logos and orange colors, and you can see we've changed our colors a little bit. That's because this summit is also part of a collaboration and a consortium with AY+. And it's really about two networks coming and working together. So the African Young Positives Network and the Pata Network coming together, bringing both frontline healthcare workers from the Pata side and young people living with HIV from the AY+ side together to really build and strengthen adolescent-friendly health services and to really make sure that young people are at the forefront of assessing services, delivering services, and influencing services that affect them most. We know at the moment there's a lot of initiatives going on. There's a lot of energy and focus and interest in peer-led services globally and regionally, a lot of movement towards test and treat all. But critically, nothing is going to be done without young people and shouldn't be done without young people leading from the front and being at the center of all of these initiatives. And I think that's why, PUT is really pleased that we were able to get enough support to dedicate one summit just to young people. For many of you who've known about the PUT Continental Summits every year, we know that sadly often peer supporters are not selected to come and travel with their teams to those summits. So that's why this year we've placed the focus on the Youth Summit, that it's really about young peer supporters dedicated in coming to this summit specifically. So just to tell you a little bit about who's joining us, we have 28 health facilities, and all of you come or are participating currently either in the REACH or the Expert Patient Program. That means we have 66 peer supporters from 7 countries here today. We have 28 supervisors. We have 7 countries represented: Tanzania, Malawi, Uganda, Zimbabwe, Zambia, DRC, and Ethiopia. And I think I've left out Cameroon. Apologies. And we have 5 national network structure representatives here from Tanzania, Malawi, Uganda, Zimbabwe, and Zambia. All together with our guests and facilitators, there are 120 people participating. But I want to leave you with this slide, and then we're going to proceed with the formal opening from Navala. But this is our challenge, and this is what I want to motivate you over the next 3 days while we're here all together. I calculated all the data from the 28 facilities that are here. When we look at that data, what we can see, there are only 36,048 children and adolescents that we in this room are reaching on treatment. But when we look at what happens to the number when we include adults, it's more than, I think, 4 times who we're reaching in terms of children and adolescents. So we have a very, very big challenge, because even within the facilities in this room, from all the patients we're reaching, only 18% of those patients are young people and adolescents. So we have so much more to do to make sure that we reach out and get more, find younger children and reach out to adolescents to make sure that we don't have this huge inequity and treatment gap that we're not just experiencing in the clinics here today, but this is something that's reflective across the whole region. So I think I'm going to leave you with that thought, and I'm hoping it's going to motivate you to work hard over the next 3 days and when we go back to our clinics. And I'm going to hand back to Paddy, and he's going to introduce Navala. Thanks.
Thank you very much, Eva. Okay, now that was not official. We are going to do the official one. Can we clap for Madam Director?